What is leaky gut syndrome? A naturopathic perspective. What if I told you that the root cause of many chronic health conditions might be hiding in plain sight, literally in your gut? What if everything from autoimmune diseases to mental health issues, skin problems, and chronic fatigue could be traced back to a condition that many conventional doctors don't even recognize as real? Today, we're diving deep into one of the most controversial yet increasingly researched topics in functional medicine: leaky gut syndrome, or as science calls it, increased intestinal permeability. Don't worry. I can understand the confusion surrounding this topic, the skepticism from conventional medicine, the conflicting information online, and the desperate search for answers by those suffering from mysterious symptoms. In the next 40 minutes, we're going to separate fact from fiction. We'll explore what the latest scientific research actually says about leaky gut, understand the mechanisms behind it, examine the evidence-based connections to various health conditions, and most importantly, discuss science-backed approaches to healing and prevention. This isn't about fear-mongering or miracle cures. This is about understanding your body through the lens of both cutting-edge research and time-tested naturopathic principles. By the end of this video, you'll have a clear, evidence-based understanding of what leaky gut really is and what you can do about it. The science of intestinal barrier function. Let's start with the basics. Your intestinal tract is far more than just a tube for digesting food. It's actually one of the most sophisticated barrier systems in your body, serving as the largest interface between your internal environment and the outside world. Think of your intestinal lining as a highly selective security system. It needs to be permeable enough to allow nutrients, water, and electrolytes to pass through, while simultaneously keeping harmful substances like toxins, undigested food particles, and pathogenic bacteria out of your bloodstream. This selective permeability is controlled by structures called tight junctions, essentially the gates between intestinal cells. These microscopic structures act like sophisticated bouncers at an exclusive club, deciding what gets in and what stays out. Here's where the science gets fascinating. Research published in gastroenterology journals has shown that these tight junctions are dynamic structures, constantly opening and closing in response to various signals. They're not just passive barriers. They're actively regulated by your immune system, nervous system, and even your gut bacteria. One of the most significant breakthroughs came with the discovery of zonulin by Dr. Alessio Fasano at Harvard Medical School. Zonulin is what scientists call the only known physiological modulator of intercellular tight junctions. In simple terms, it's like a master key that can open those tight junction gates. Under normal circumstances, zonulin release is tightly controlled, allowing for appropriate nutrient absorption while maintaining barrier integrity. However, when this system becomes dysregulated, whether due to stress, medications, or dietary factors, the result is increased intestinal permeability, or what we commonly call leaky gut. When the intestinal barrier becomes compromised, larger molecules that shouldn't cross into the bloodstream, partially digested proteins, bacterial components, toxins, can slip through. Your immune system, encountering these foreign substances in places they shouldn't be, mounts an inflammatory response. This is where things get complicated and where the controversy begins. Because this inflammatory response doesn't stay localized to the gut, it can become systemic, potentially affecting every organ system in your body. The controversy and evidence. Now, let's address the elephant in the room. Leaky gut syndrome is not currently recognized as a formal medical diagnosis by conventional medicine. Many gastroenterologists and primary care physicians view it with skepticism, often dismissing it as pseudoscience. Their concern isn't entirely unfounded. The term leaky gut syndrome has been overused and oversimplified in popular health media, sometimes blamed for virtually every health condition without sufficient scientific evidence. This has understandably made many doctors wary. However, what's fascinating is that while the syndrome itself remains controversial, the underlying science of increased intestinal permeability is becoming increasingly well documented. A 2024 study published in Gastroenterology examined intestinal barrier function in gut-brain disorders, confirming that barrier dysfunction plays a significant role in various gastrointestinal conditions. Over the past decade, we've seen an explosion of peer-reviewed research on intestinal permeability. Studies published in journals like Nature Communications, Internal and Emergency Medicine, and Clinical and Experimental Medicine are providing increasingly sophisticated insights into how barrier dysfunction occurs and its clinical implications. For instance, research has demonstrated that increased intestinal permeability can be measured and quantified using various laboratory techniques. It's not just a theoretical concept. It's a measurable physiological state that correlates with specific biomarkers, including elevated zonulin levels in blood and stool samples. Some of the most compelling evidence comes from autoimmune disease research. Studies have consistently shown that conditions like celiac disease, Crohn's disease, and type 1 diabetes are associated with increased intestinal permeability, often occurring before the onset of clinical symptoms. What we're seeing is a gradual convergence between functional medicine practitioners who have long recognized the importance of gut barrier function and conventional researchers who are now documenting the mechanisms and clinical relevance of these observations. My approach is to stay grounded in the evidence while remaining open to the clinical insights that come from working with patients. The research is clear. Intestinal barrier dysfunction is real, measurable, and clinically relevant. What remains to be fully elucidated is exactly which symptoms and conditions can be directly attributed to it. Understanding the mechanisms. Let's dive deeper into exactly how leaky gut develops at the cellular level. Your intestinal barrier consists of several layers of defense, and understanding these can help you appreciate both how complex and how fragile this system really is. The first barrier is your mucus layer, a protective coating that contains antimicrobial compounds and beneficial bacteria. Think of it as the moat around a castle. When this mucus barrier is compromised by factors like chronic stress, certain medications, or inflammatory foods, it exposes the underlying intestinal cells to potential harm. The next layer is the intestinal epithelium, a single layer of cells that are held together by those crucial tight junctions we discussed earlier. These cells are remarkable, turn over completely every 3 to 5 days, which means your intestinal lining is constantly regenerating. Here's where zonulin comes into play. When certain triggers, like bacterial toxins, gluten proteins, or inflammatory cytokines, bind to receptors on your intestinal cells, they can stimulate the release of zonulin. Zonulin then acts like a key, unlocking the tight junctions and increasing permeability. Once the barrier is compromised and foreign substances enter the bloodstream, your immune system activates. This creates inflammatory molecules called cytokines, which can further damage the intestinal barrier, creating a vicious cycle of increased permeability and inflammation. What makes this particularly significant is that substances passing through the compromised intestinal barrier go directly to your liver via the portal circulation. Your liver, your body's primary detoxification organ, can become overwhelmed trying to process these inappropriate substances, potentially leading to what functional medicine practitioners call toxic overload. Recent research has highlighted the crucial role of your gut microbiome in maintaining barrier function. Beneficial bacteria produce short-chain fatty acids, which serve as fuel for intestinal cells and help maintain tight junction integrity. When this microbial ecosystem is disrupted through antibiotics, stress, or poor diet, barrier function suffers. Perhaps most intriguingly, research shows that the gut-brain axis plays a significant role in barrier regulation. Chronic stress activates the hypothalamic pituitary adrenal HPA axis, releasing hormones like cortisol that can directly increase intestinal permeability. This explains why emotional stress can literally make your gut more leaky. Causes and triggers. Understanding what causes leaky gut is crucial for both prevention and treatment. The research shows us that intestinal barrier dysfunction rarely has a single cause. It's typically the result of multiple factors working together over time. Let's start with diet, since this is often the most modifiable factor. Research has identified several dietary components that can increase intestinal permeability. Gluten is perhaps the most studied. It activates zonulin release even in non-celiac individuals. Though the effect is typically temporary in healthy people, highly processed foods present multiple challenges. They often contain emulsifiers, compounds that help mix oil and water, which studies show can disrupt the mucus barrier and alter gut bacteria. They're also typically high in sugar and refined carbohydrates, which can promote the growth of harmful bacteria that produce inflammatory compounds. Alcohol deserves special mention because it has both direct and indirect effects on barrier function. It can directly damage intestinal cells while also altering the gut microbiome, creating conditions that promote increased permeability. Several classes of medications can compromise intestinal barrier function. Non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, are well documented to increase intestinal permeability, even with short-term use. Proton pump inhibitors, commonly prescribed for acid reflux, can alter the gut microbiome in ways that compromise barrier function. Antibiotics present a particular challenge. While sometimes necessary for treating bacterial infections, they can significantly disrupt the beneficial bacteria that help maintain barrier integrity. A single course of broad-spectrum antibiotics can alter your gut microbiome for months. Chronic stress is one of the most underappreciated factors in gut barrier dysfunction. Research shows that psychological stress can increase intestinal permeability within hours through the release of stress hormones and inflammatory mediators. This explains why many people notice digestive issues during stressful periods. Our modern environment presents unique challenges. Exposure to pesticides, heavy metals, and other environmental toxins can damage intestinal cells and disrupt the microbiome. Even air pollution has been linked to increased intestinal inflammation. Gastrointestinal infections, whether bacterial, viral, parasitic, or fungal, can damage the intestinal barrier both during the acute phase and sometimes for months afterward. Small intestinal bacterial overgrowth, SIBO, and candida overgrowth are particular concerns in functional medicine. Aging naturally affects barrier function. Research shows that intestinal permeability tends to increase with age, possibly due to decreased regenerative capacity of intestinal cells, changes in the microbiome, and accumulated inflammatory damage over time. Symptoms and associated conditions. One of the reasons leaky gut syndrome remains controversial is that its symptoms can be vague, varied, and overlap with many other conditions. However, understanding the potential manifestations can help you recognize patterns that might indicate barrier dysfunction. The most obvious symptoms occur in the digestive system itself. These might include chronic bloating, gas, diarrhea, or constipation, abdominal pain, and food sensitivities that seem to develop out of nowhere. Many people describe feeling like they can eat anything when they're younger, then suddenly developing multiple food intolerances. This progression of food sensitivities is actually quite logical when you understand the mechanism. When incompletely digested food proteins cross a compromised intestinal barrier, your immune system may develop antibodies against them. This can create reactions to foods that previously caused no problems. Because leaky gut can trigger systemic inflammation, symptoms can appear far from the digestive tract. Chronic fatigue is common. Inflammation is energetically expensive for your body. Joint pain and stiffness may occur as inflammatory molecules circulate throughout your system. The skin is often called the mirror of the gut, and research supports this connection. Conditions like eczema, psoriasis, acne, and rosacea have all been associated with increased intestinal permeability. The gut-skin axis is an active area of research, with studies showing that improving gut barrier function can improve skin conditions. Perhaps most intriguingly, research is revealing strong connections between gut barrier dysfunction and mental health. The gut-brain axis means that inflammation originating in the gut can affect brain function, potentially contributing to anxiety, depression, brain fog, and mood swings. Some of the strongest evidence for leaky gut comes from autoimmune disease research. Conditions like rheumatoid arthritis, Hashimoto's, thyroiditis, and multiple sclerosis have all been associated with increased intestinal permeability. While we can't say that leaky gut causes these conditions, it appears to be an important contributing factor in genetically susceptible individuals. Research has shown links between increased intestinal permeability and the development of environmental allergies and asthma. The theory is that when allergens cross a compromised gut barrier, they're more likely to trigger immune sensitization. Emerging research suggests that gut barrier dysfunction may contribute to metabolic disorders, including insulin resistance and obesity. The mechanism appears to involve bacterial endotoxins, crossing the compromised barrier and triggering metabolic inflammation. What's important to understand is that having some of these symptoms doesn't automatically mean you have leaky gut. However, if you have multiple symptoms from different categories, digestive issues plus skin problems plus fatigue plus mood issues, for example, it might be worth investigating whether intestinal barrier dysfunction could be a contributing factor. Testing and assessment. Unlike many conditions with straightforward diagnostic tests, assessing intestinal permeability requires a more nuanced approach. The good news is that we now have several evidence-based methods for evaluating gut barrier function. The gold standard for measuring intestinal permeability in research settings is the lactulose-mannitol ratio test. This involves drinking a solution containing these two sugars, then measuring their levels in urine. Lactulose molecules are larger and shouldn't normally cross an intact intestinal barrier, while mannitol molecules are smaller and should cross readily. An elevated lactulose-mannitol ratio suggests increased permeability. More recently, testing for zonulin levels has become available. Zonulin can be measured in both blood and stool samples. Elevated levels suggest that the zonulin pathway is activated, potentially leading to increased intestinal permeability. However, it's important to note that zonulin levels can vary significantly day to day. So interpretation requires clinical expertise. Comprehensive stool analysis can provide valuable indirect information about barrier function. Tests can measure markers of inflammation like calprotectin, beneficial bacteria levels, harmful bacteria or yeast overgrowth, and digestive enzyme activity. While these don't directly measure permeability, they can reveal factors that contribute to barrier dysfunction. While food sensitivity testing is popular, it's important to understand its limitations. IgG food sensitivity tests measure immune reactions that might result from leaky gut, but they don't diagnose the condition itself. These tests can be helpful for identifying foods that might be triggering inflammation, but they should be interpreted in the context of symptoms and other assessments. Blood tests for inflammatory markers can provide supporting evidence. C-reactive protein CRP, erythrocyte sedimentation rate, ESR, and cytokine panels can help assess whether systemic inflammation is present, which might be related to gut barrier dysfunction. Often, the most valuable assessment is a thorough clinical evaluation. A skilled practitioner will look at your symptom pattern, health history, medication use, stress levels, and dietary habits to assess whether leaky gut might be a contributing factor to your health issues. It's crucial to understand that no single test definitively diagnoses leaky gut syndrome. The testing helps us understand whether intestinal barrier dysfunction might be contributing to your symptoms. But interpretation requires clinical expertise and should always be done in the context of your overall health picture. In functional medicine, we often take what's called a therapeutic trial approach. If someone has symptoms consistent with leaky gut and risk factors that make it likely, we might implement gut healing interventions and monitor response rather than relying solely on testing. The naturopathic approach to healing. The naturopathic approach to healing leaky gut follows a systematic framework, often called the 4 R's: remove, replace, repair, and rebalance. This evidence-based approach addresses the root causes while supporting your body's natural healing capacity. The first step is identifying and removing factors that compromise gut barrier function. This often starts with dietary changes. We might implement an elimination diet to identify food triggers, remove processed foods high in inflammatory compounds, and temporarily avoid alcohol and NSAIDs when possible. A properly conducted elimination diet removes the most common trigger foods: gluten, dairy, soy, corn, eggs, nuts, and sometimes nightshades, for a period of 3 to 4 weeks, then systematically reintroduces them while monitoring symptoms. This isn't meant to be a permanent restrictive diet, but rather a tool to identify your individual triggers. If testing reveals bacterial overgrowth, parasites, or yeast overgrowth, these need to be addressed with appropriate antimicrobial protocols. This might involve herbal antimicrobials, which research shows can be as effective as pharmaceutical options for certain conditions with fewer side effects. The second step involves replacing factors that support proper digestion. This might include digestive enzymes if testing shows deficiencies, hydrochloric acid support for those with low stomach acid, and bioacid support for those with gallbladder issues. Digestive enzymes can help ensure that proteins are fully broken down into their component amino acids, reducing the likelihood that partially digested proteins will trigger immune reactions if they cross the intestinal barrier. Specific enzymes like DPPIV can help break down gluten and casein proteins. The third step focuses on providing nutrients that support intestinal barrier repair. L-glutamine is perhaps the most studied nutrient for this purpose. It serves as fuel for intestinal cells and helps maintain tight junction integrity. Research supports doses of 5 to 15 grams daily for gut repair. Other important nutrients include zinc, which is crucial for tissue repair and immune function, vitamin D, which helps regulate immune responses and may support barrier function, and omega-3 fatty acids, which have anti-inflammatory properties and support cell membrane integrity. Several herbs have shown promise for gut barrier repair. Deglycyrrhizinated licorice DGL has been shown to support the protective mucus layer. Slippery elm and marshmallow root provide soothing mucilage compounds. Aloe vera gel has anti-inflammatory properties and may support tissue repair. The final step involves re-establishing a healthy gut microbiome. This typically involves targeted probiotic supplementation with strains chosen based on research for specific conditions. Lactobacillus and Bifidobacterium species are often foundational, but specific strains matter. Probiotics work best when combined with prebiotics, fibers that feed beneficial bacteria. Foods like garlic, onions, leeks, asparagus, and Jerusalem artichokes provide prebiotic fibers. For some people, we might use specific prebiotic supplements during the healing process. Healing leaky gut isn't just about supplements and diet. Stress management is crucial. Chronic stress can undermine all other interventions. This might involve meditation, yoga, adequate sleep, regular exercise, and addressing psychological stressors through counseling or therapy. Gut barrier repair is typically a gradual process. Most people begin noticing improvements within 2 to 4 weeks, but complete healing often takes 3 to 6 months or longer, depending on the severity of the dysfunction and how long it's been present. Patience and consistency are key, prevention and long-term maintenance. While healing a compromised gut barrier is certainly possible, prevention is always preferable. Understanding the factors that support long-term gut barrier health can help you make informed choices that protect this crucial system. A gut-supportive diet emphasizes whole, unprocessed foods while minimizing inflammatory compounds. This doesn't mean following a restrictive diet forever, but rather making choices that support rather than challenge your digestive system most of the time. I often recommend what I call the 80/20ths approach to patients. If you're making gut-supportive choices 80% of the time, your body can usually handle the occasional indulgence without significant problems. This makes the approach sustainable long-term while still protecting gut health. Research increasingly shows that microbiome diversity is crucial for gut barrier health, and the best way to support microbial diversity is through dietary fiber diversity. Aim for 25 to 30 different types of plant foods per week. This includes fruits, vegetables, herbs, spices, nuts, seeds, and whole grains if you tolerate them. Traditional fermented foods like sauerkraut, kimchi, kefir, and miso provide both probiotics and compounds that support gut barrier function. These foods have been part of human diets for thousands of years, and research is confirming their benefits for digestive health. How you eat is as important as what you eat. Eating in a relaxed state activates the parasympathetic nervous system, which optimizes digestion. Taking time to chew thoroughly, avoiding distractions during meals, and practicing gratitude for your food can all support digestive health. Regular moderate exercise has been shown to support gut barrier function and promote beneficial bacteria growth. However, intense exercise can temporarily increase intestinal permeability, so balance is important. Activities like walking, swimming, yoga, and moderate strength training are generally beneficial. Your gut has its own circadian rhythms, and disrupted sleep can compromise barrier function. Aiming for 7 to 9 hours of quality sleep and maintaining consistent sleep-wake cycles supports both gut health and overall well-being. Since chronic stress is one of the most significant factors in gut barrier dysfunction, developing stress resilience is crucial for long-term gut health. This might include regular meditation, time in nature, meaningful social connections, and engaging in activities that bring joy and fulfillment. When antibiotics are medically necessary, taking steps to minimize their impact on gut bacteria can help preserve barrier function. This might include probiotic supplementation during and after antibiotic treatment, though timing and strains should be discussed with your healthcare provider. While we can't control all environmental exposures, we can make choices that reduce our toxic burden. This might include choosing organic foods when possible, using natural cleaning and personal care products, and ensuring good air quality in your home. Even with the best preventive practices, it's worth periodically assessing your gut health. This might involve paying attention to symptoms, periodic, comprehensive stool testing, or working with a healthcare provider trained in functional medicine to monitor your progress. As we've seen throughout this discussion, the science of intestinal barrier function is complex, fascinating, and increasingly well documented. While leaky gut syndrome may not be a formally recognized medical diagnosis, the underlying physiology of increased intestinal permeability is real, measurable, and clinically significant. We're witnessing a paradigm shift in how we understand health and disease. The traditional model that viewed the gut simply as a digestion organ is giving way to an understanding that positions the intestinal barrier as a crucial interface between our internal environment and the outside world, one that significantly impacts our overall health. What's most encouraging is that this isn't a passive process you have no control over. Your daily choices, what you eat, how you manage stress, how you sleep, how you move your body, all directly impact your gut barrier health. You have more power over your health than you might realize. Remember that healing is individual. What works for one person may not work for another, and that's okay. The key is working with healthcare providers who understand both the science and the art of functional medicine. Practitioners who can help you identify your unique triggers and develop personalized protocols. Healing takes time. In our instant gratification culture, it's important to remember that your body needs time to rebuild and repair. The gut lining replaces itself every few days, but full barrier restoration can take months. Trust the process, be consistent with your interventions, and celebrate small improvements along the way. I've seen remarkable transformations in patients who address gut barrier dysfunction. People who've struggled with chronic symptoms for years can experience significant improvements when we address the root causes systematically and comprehensively. If this information resonates with you and you're experiencing symptoms that might be related to gut barrier dysfunction, consider working with a healthcare provider trained in functional or naturopathic medicine. They can help you assess whether leaky gut might be contributing to your health issues and develop an appropriate treatment plan. Even if you don't pursue formal testing or treatment, you can start implementing gut-supportive practices today. Focus on whole foods, manage your stress, prioritize sleep, and listen to your body. These fundamental practices support not just gut health, but overall well-being. Remember that healing happens in community. Surround yourself with people who support your health goals. Share what you've learned with others who might benefit, and don't hesitate to seek support when you need it. Your health is not your fault, but it is your responsibility. You have the power to make choices that support your body's incredible capacity for healing and regeneration. Trust in that capacity. Be patient with the process, and know that every positive change you make matters. The research is clear. We now understand more about gut barrier function than ever before. The question isn't whether this science is valid. It is. The question is what you'll do with this knowledge to support your own health and well-being. Your journey to optimal gut health starts with a single choice. What will that choice be? Thank you for joining me on this deep dive into the fascinating world of gut barrier function. If this information was helpful, please share it with someone who might benefit. Knowledge is most powerful when it's shared. What questions do you have about leaky gut or gut barrier function? What symptoms or experiences have led you to explore this topic? I read every comment and love hearing about your health journeys. For more evidence-based content on natural health and functional medicine, subscribe and hit that notification bell. And remember, every step toward better health, no matter how small, is a step in the right direction. Your gut health matters. Your overall health matters. And you have more power to influence both than you might think. Until next time, be well, stay curious, and trust in your body's amazing capacity for healing.